Welcome everyone to the second part of a two-part webinar that WAVE and SAGE are delighted to be hosting together. My name is Kit McMahon. I'm the National Co-Convener of WAVE, and I'm joined here today by Isabel. Would you like to introduce yourself?
Yeah, sure. So my name is Isabel Kingsley. I work at Science in Australia Gender Equity, which is, among many other things, an accrediting body here in Australia that works with higher education research institutions to improve their equity, diversity, and inclusion.
Amazing. Thank you. And today we're bringing you another look into the world of how we actually create equity, but we're going to really focus today on the solutions, and delighted that Isabel and Sage are here to share themselves as the case study of that work. Before we go on, really important that we just all acknowledge that we are on unceded lands of First Nations people. I'm coming to you today from the lands of the Wurundjeri Woiwurrung people, and I want to pay my respects to the elders of these lands and also the lands that you're coming from today. When we do the webinars, and this is a recording, we just ask that people take the time out to be present. And sometimes the issues that we often raise could be confronting. And if that's the case, just take yourself off, or if you're watching this recording, just turn it off and take a moment. It's a learning journey. So often we bring a lot of judgment to that. So just be respectful of that you're in a learning process, or you might be reinforcing stuff you already know. That's great. But we just ask you also to give yourself the opportunity to be virtually present in what you're doing and hearing, as we are today, present, absolutely. Just to recap who WAVE is, look, our core business is advocacy, and it's trying to make sure that our vocational education and skills system is equitable. And of course, that includes all the trades, including those that are identified as STEM. But what we want to see in the future is an education system where all girls and women can, in all their forms, can participate fully, so that they can have well and fulfilling lives, which is something that I think SAGE and WAVE share deeply, that hope. And look, we work in a way that centres that feminist base that we came to, that we seek always to advocate for centering of lived experience in decision making. We firmly believe that education is transformative, but always understanding that you cannot do anything if it's not done well in partnership, which is what we're delighted that we can do today with our colleagues and friends at SAGE. Isabel, you talked a little bit about SAGE before. Is there anything, I can see you've got a different brand there called Athena Swan.
Yes.
Yeah.
So what is Athena Swan? So SAGE is a not-for-profit organization. It was founded in 2015, sorry.
Wow.
By the Australian Academy of Science and the Australian Academy of Technology and Engineering. And the purpose of SAGE was to advocate for gender diversity and equity in higher education and also research institutions.
Yeah, right.
And we do that by working with institutions and partnering with them and supporting them, but also providing an accreditation through the Athena Swan Charter, which comes from the UK. This charter is about 20 years old, and it has been implemented in around the world. So in Ireland, here in Australia, under SAGE, in Canada, in the US. So it's a really well-regarded accreditation charter.
So you're joining it. That's amazing. And because this session's about the solution. I'll go into what the first session was, but just that use of accreditation and frameworks to drive change, I think, is another really good way that we create action around equity. So it's going to be really good to hear more.
Yeah, absolutely. Because accreditation isn't just about getting that stamp of approval or ticking that box. It's really about the framework that provides scaffolding and support and guidance to achieve, the work that we want to achieve.
Yeah, and so often we think people just know stuff, but people need a journey. They need a map of the future, don't they? So in the first session, what we really did is we looked at the challenges, we looked at the data and the evidence, and we'll go into that, recap that in a little bit. But what we want to do today is focus on what the initiatives for change are. I think so often, Isabel and I were just talking about this before, that often it's just seen as one activity or one event will fix it, but it's not. It's a whole range of kind of initiatives that come together for change. We're going to kind of sort of look at what works and what doesn't work just a little bit. But what we're really aiming to do is to say, well, what is transformative? Because that's where the change work happens. That's where you actually get the return on the money that you invest at that point. And we're going to ask, ourselves, well, what are the considerations that we need to make the change? So just looking back, if you recall in our first webinar, which you can look at online on the WAVE website, we kind of started to do some basics to look at the difference between equity, equality, and justice, and that great kind of, in my world, that's a bit of a famous meme, that one there, about it sort of tries to describe it in a way that's in a really good illustration. But we also took the time to actually understand the deeper part of change work, which is that there are intersecting barriers, society, economies, policy, systems and structure set up a series of barriers that intersect together to prevent people from achieving, being emancipated, achieving their potential as well. And part of our work is to identify what those are and address them. And we also took the time to look at, what is the data? This is from the 2024 Australian Status of Women report card. It's online. But just to understand that those barriers are very much there. And Isabel, this is your data. This is the SAGE data that shows that the barriers are absolutely present for one of those intersecting characteristics of people, gender, in STEM. And just quickly, do you want to just quickly say what that says before we go into those solutions for change?
Yeah, absolutely. So this data is from the Australian government's Department of Industry, Science and Resources. It's from the STEM Equity Monitor. It's actually, if you ever want to know anything about, any data on gender equity in Australia, you go to the STEM Equity Monitor. It's amazing. It's got everything and it's very interactive. You can select and deselect things. So play around with that. But what we're seeing here on this slide is really a story about the journey from STEM enrollments in year 12, which we can see are at parity or very close to parity. We would call that parity if we're thinking about calling parity 40% women, 40% men, and 20% a mix of gender diversities and identities in there. And so it's at parity, but then as you kind of move along to university enrollments and university completions, you can see that that's kind of dropping. And then when you look at STEM qualified occupations, you see that now there's a very big gap. And interestingly, those data come from way back, which is nice to have that longitudinal data, but you can see a slight kind of upward incline,
closing a little bit
gap, but very little. And then when you look at the STEM teaching and research workforce, as well in the university sector, higher education sector, you really see that there's as career seniority increases.
And that's the level A, B, C, D, E. Is that
that's right? A, B, C, D, E. So A being like an early career researcher to E, which is like full professor. So from early career researcher all the way to associate professor and professor. And so the number and proportion of women declines. So something is happening there, and that's what we call the leaky pipeline, which is women are leaking out of the workforce pipeline. There's parity at year 12. There's general parity in, university and vet not in every field, but generally, and then it starts to decline. So women are just leaking out of that pipeline for many complex reasons. There's many reasons.
So it's a thing, isn't it? It's a thing.
It's a thing.
It's a thing.
Yeah.
All the data says it's a thing. And that's what we went into last time. But I think sometimes we can, it's really good to focus on the data and that it's a thing. But what I'm delighted that we can do now is think, right, well, how do we address the thing? Yeah. So what are the solutions? So what we want to do now is we'll use SAGE to show how these strategies work in practice, but we'll just do a little bit of an overview about what those strategies might be, their impact, and some of the opportunities and how they form, if that's okay to start with. So there are a heap of things you can do. And for many of us, these are not unusual. We can lobby, right? We can create campaigns. We can educate. We can develop policy, whether that's in organisations or in government. Monitoring is really powerful. And, you just saw SAGE talk about the monitoring data, the equity and STEM monitor as well. Communicating, but partnership building is also vital. So all of these are different things that we call upon when we do the work to address inequity in STEM or any field. These are kind of the different tactics and things that we call upon. If you work in primary prevention or health promotion or gender equity, this is like your toolbox. But when we're doing this work, right, one of the things we want to make sure, thanks, Isabel. One of the things that we want to do is we want to make sure that we're actually doing work that makes a difference. So you've probably heard a couple of times Isabel and I talk about that it's not just one thing. And the reason we say that is we really want to be working up at the end of this horrendously complex slide, which is about making a difference and change. You actually want to work up to creating equity. That's what you want to be doing. You actually want to be doing work that deliberately addresses the causes of inequality. It's got to be life-changing, or the technical word is transformative. But from time to time, or maybe I might be a bit kind there, often we will see activities that actually are more down the other end. Less and less we're seeing activities that perpetuate inequity. But we still see that from time to time. It might be an advertising for a role that perpetuates a stereotype, right? It might be a way that the policy for accessing recruitment might unwillingly or unknowingly set up inequity. But you can see that. When it's deliberate, we now have laws in place that can tackle it. But, there is gender blind. So people do work and activities or try to or do their day-to-day in a work that is blind to inequality. And actually that can continue to go around that exploitation and have very limited impact. More often than not, though, we see that the language is around called being gender responding. They're responding to it. So you actually acknowledge that there's a problem, but don't do anything about it. Or you don't deal with the underpinning drivers. Then you can do work that's specific. But the work is not actually, again, changing those underlying drivers. It might be one-off events or activities. For instance, in my line of work, often I see recruitment campaigns to get women into trades, which is very specific. And it's all about the women, but it's not actually addressing the underlying causes of the situation. And often you'll hear people like me and Isabel go, but it's not their problem. It's not a women's problem, right? So we want the work to be life-changing and transformative. And often the way that occurs is that we use lots and lots of those pieces in the toolkit. And importantly, we use the evidence. And as I said to someone the other day, it's hard, grindy, grafty work. It involves hard conversations, regularly saying the same thing again and again, and sitting with the point of accountability. Now, often those resources to do this work don't need much, you know, and for small organisations, and WAV's one of those, you know, telling the stories of others, the centering the lived experience, you know, raising public awareness in someone. Networking is a really important thing. Grassroots mobilisation and workshops and training. Well, this is one. Now with the age of technology and the interwebs, you know, those workshops and information sharing and storytelling is a low cost. But at the other end, the investment required to do the lobbying, the collect the data, which is why, Isabel, you know, the government collecting the STEMM monitoring is a really, really helpful resource for the work. Drafting any legislation, huge expense. Litigation, employing incredible levels of technology, but monitoring and evaluation takes high levels of resources. If you're going to do it properly, you actually need to bring in resources. So what we need to know is that there could be, you can call on all these things, but one of the limitations on it is the resources available to often women's movements to do that work. Contrast that with the fact of what's going to give you the highest impact. And you can see that often the things that have the highest resources are the ones that have the highest impact as well. There's some that, you know, low cost, high impact, like training, mobilizations, media engagement, but more often than not, what we're trying to do is do work to achieve the impact, to do the transformative change. But one of the limitations is that those high impact ones, you actually need a lot of resources. And this is why we use partnerships. This is why we do collaboration. This is why we find ourselves mobilising to try to bring people on the journey and agree on shared messaging, for example. But importantly, it's about that collective work where we're all kind of sharing and doing similar activities to a shared goal, like SAGE, like WAVE, like other partners. And it's through that collective work. We also do work where we can activate others and support others to do change work as well. And that's called capacity building, isn't it? And this is what I guess SAGE is there for. It's not doing the work, it's enabling and enhancing and building the capacity of others to sustainably do it, to share the expertise. So let's think about the solutions. Let's think about all of those things we can do, but let's look at a solution case in action. And when you're looking at this, it's the comprehensiveness of it. It's the transforming. This is actually addressing the root cause, and it's the journey mapping. And remember, we're talking to people who don't know how to do it. It's not their expertise. So that's another opportunity for us to encourage learning. So delighted to hand over to you, Isabel, for you to share the SAGE story.
The SAGE story, yes. Well, actually, the SAGE journey. So as I was saying before, as part of our advocacy and support and capacity building that we do, is we use the Athena Swan accreditation framework to guide our subscribing institutions through through their pathway, through their journey of equity, diversity, and inclusion. And that pathway has three main steps. Bronze, you start at bronze, then you go into silver, and then you go into gold. And those are levels of gender equity, diversity, and inclusion maturity. So with increasing maturity, you get to gold. And what we've done here in Australia is we've added, in between bronze and silver, and in between silver and gold, we've added 5 signets, which are almost like, I guess we could call them a bit of a progress report on how institutions are tracking on, you know, those things that they're trying to improve.
Signet is a baby swan, isn't it, Isabel?
It is. It's the baby swan. Yes. So in practice, this is what the pathway looks like. So when an institution says, okay, we want to be part of the SAGE family, we want to jump on board, what do we do first? We say, okay, well, you're in the now bronze kind of realm of the pathway. The first thing we get them to do is to do a self-assessment. So year one of bronze subscription is a self-assessment. It's really the institution, whether it's a university, a medical research institute, whatever it is, they look inwards. They look at their data, they talk to their people, and they find out as much as possible what the state of affairs is in their organization, and what are some of the key barriers that are in the way for women, but also diverse genders, and also, you know, all the other, you know, we were talking about intersectionality, all of the other identities that, you know, people have that, you know, there may be barriers there that are not conducive to people really achieving their full potential.
I mean, it's really interesting you say that, because practically we know that equity starts with self, that you've actually got to reflect on your own privilege and power, and you've actually got to give people space to reflect on their own context. And it's so important to give people that space to do that, because if they look hard enough, often it's that point of crisis where they look and they go, oh no, what are we doing, you know? So having that moment and that space to do that, I think, is really, really important.
Absolutely, so important. And how can you ever make informed decisions about what you need to do if you haven't really looked inward and
You'll be
assessed?
blind. You'd be blind.
Yeah, you'd be
Or
blind.
actually causing more harm. Yeah, crucial.
Correct. So the first year is really self-assessment. And as you can see in the little purple circle there, the self-assessment, and also the rest of the, you know, strategy building and action planning and everything is self-driven. So we provide support, but we really believe that institutions need to do that themselves for agency, for establishing you know, that leadership within the institution. So we're there to help, but you know, the accountability is within.
Ask a question. How much time through this process, because leadership buy-in is really important, isn't it, Isabel?
Yes.
How much time has you found in this work do you spend with the leadership to build their capacity in year 1 through to year 2?
It depends on the
it
institution.
depends. So it's not a sort of cookie cutter model. Depends on where,
No, because it's something that is extremely important, but not the extent to which it is truly there, genuinely there, and genuine is so different everywhere. You know, we have some students who join SAGE, and it's their leadership really genuinely wanting to make a difference so that they can make a great place for their people.
Yeah, right.
And other times it's, you know, from the grassroots up.
Yeah, right.
People asking, can we be part of SAGE? Something needs to be done.
Okay.
And resistance with leadership. And this can take years.
Yes.
We sometimes see still resistance to leadership, you know, in halfway through like 5 signets, or do you know, like
okay. Yeah.
it just takes time if it's not really there, or if there's some resistance, or it's not quite genuine. So
and that's it. It's the time piece. It's a long-term change. Sorry, I keep interrupting you. Please, sorry.
that's okay. These are really good things to talk about, because it is so important.
Yeah.
But yeah, so after the self-assessment, then you can kind of assess, well, what are the issues? What are the problems? What do we need to work on? And then we get institutions to identify those key barriers and pick 5, prioritize 5 that they want to work on their journey to silver. And so that's where you get the 5 signets, because each signet is like a progress report on those 5 key barriers that they are
there you go.
working on.
Okay. Yep. Great.
Yeah. And then after the 5 signets, they apply for silver, where they kind of take a step, like a pause, a breather. have a look at how things are going again. Since bronze, since our 5 signets, what does our institution look like? What are the 5 next things we want to focus on, or what are the ongoing things that we need to continue to work on?
Okay.
And then that's the journey into gold.
Yeah,
So
great.
it's a very long journey. Most,
Yep.
you know, from bronze to silver is usually like 7, 8, 9 years.
Yeah.
Yeah.
Yeah. I mean, you're talking about,
Oh,
look, I always talk about, when I was growing up, when my dad was a little kid, he was told smoking was healthy. I walked around with coconut oil on my skin. We didn't have driver's seats. It's taken a long time, right? This behavioural change, attitude, norm pave takes time, and
yeah.
that's why that's why it takes the way. I think we just assume there's going to be flick a switch, and it's just not like that.
No, not at all. No,
Yeah.
it's not a quick fix. So
Yeah.
yeah, you have to be willing to really take it seriously and take the time to do it right.
Yeah.
Yeah. But if we go to the next slide, this is just a bit of a snapshot of who
Wow.
working with us. So
42, that's
we have
huge. That's great.
yeah, 42 higher education and research institutions working with us. And that accounts for around 87% of all university employees in Australia and 51% of all medical research employees in Australia. So yeah, we're pretty proud of that. That we've got a lot of subscribing institutions, which means that we have a lot of organizations in Australia really doing the work with us, which is lovely to see.
But look at the coverage as well. I think the other thing too that's often not spoken about in strategic equity change is actually it can have secondary and tertiary flow-ons. You might be dealing with one person, but that one person will influence others. So actually, that figure of 87%, and people can think about that with their own work. You might have a few people sitting around the table, but remembering they are actually through your work influencing others as well.
Yes, yes, absolutely.
Yeah.
And then if we look at where these institutions are on the progress of their pathway or their Athena Swan kind of journey, we have 2 that well, most of them have gone through bronze. And we've got 24 of our institutions right now actually working on their first signet.
Yep.
And then you can see the rest there. So 6, 6, 2, and 2 are kind of in the signet zone. And we've got some institutions very, very like approaching the next phase, which is the silver.
2 institutions with 5 signet awards.
Yes.
That's exciting.
Yes, it is exciting. Yeah. And it's great to see because Sage is quite young, as
Yeah.
we're going to be celebrating 10 years, our 10-year anniversary next year.
Yeah.
So
Yeah.
so yeah, that's how long it basically, some of these institutions have been with us since the beginning, and they've been working towards that. So it's exciting to see that 2 of them have their 5th signet and are working towards silver.
That's so good.
Yeah. And then if we move on
The
to
impact.
look at what's the next slide? Because
we look at the impact. We look at the change.
oh yeah, the impact. There we go. I was like, where are we?
Yeah.
So this is according to the Workplace Gender Equality Agency earlier this year released workplace gender equality and gender pay gap data, but by organization level. For the first time this year, it was by organization level. And so we were able to do a little bit of a data analysis, and we can see that the institutions that work with Sage actually have a smaller gender pay gap than the institutions who don't.
Yep. There it is.
And not all of them have done work specifically on the gender pay gap, but I think that what this story kind of tells is that if the institution is dedicated and committed to improving and thinking about equity,
Yep.
it translates into other areas such as gender pay gap, for example.
Yep.
Yeah.
And I think if we think about impact, this is absolutely one of the indicators of change. You would expect this to occur.
Yes.
And I know you've got another slide coming up that actually shows there's a change in composition, which is part of the pay gap, but it's also a unique indicator in and of its own right. Which
absolutely, yeah. So it is part of the gender pay gap. It's an indicator on its own, but contributes to the gender pay gap. But yes, SAGE institutions are increasing their proportion of women in senior leadership roles. So SAGE institutions or SAGE subscribers have, usually around 68%. Have seen an increase in the proportion of women in senior leadership roles compared to only 32% of non-subscribers. So again, you can see there that the things that these institutions are doing are contributing to that change in there.
And on the ground, can I tell you, in my day job at a women's health service, that change in leadership has massive implications in terms of services. So I know the more diversity I have in that leadership, particularly in medical research institutions, the things that are researched, the items that are discussed, the decisions that are made will actually have benefit on the ground for women that work or that live and work and play in my local area. So it's not just about the number, it's about, again, the ramifications of that. That is a really impressive number.
It is. So if I can give you an example of, because you might be thinking, okay, so what are these things that people are doing? Like, what are these things that institutions are actually doing as part of their journey? So let's take Geoscience Australia, for example. They are a publicly funded research agency. They've been a subscriber with SAGE for quite a long time. And so one of the things that they did was they promoted inclusive behaviors in their Athena. So after they, did their self-assessment, they thought, there's identified 5 barriers, and one of them was really just like,
so this is one of the 5
our inclusive behaviors are
this is
not
one of the
that
5
great.
things I chose. Okay, cool.
And so what do we mean by inclusive behaviors? Like, what is that actually? So some of the things they did was they embedded diversity and inclusion in their strategy, 2028 strategies. They established a diversity champions in their senior leadership team. They did a reconciliation action plan. They came up with sexual harassment policy and procedures, new policy and procedures, and accompanied new anonymous reporting hotline and mandatory learning modules for sexual harassment. Sorry, go ahead.
No. What I'm really excited about that is often we can go into organisations to talk about equity, and equity work is considered separate to reconciliation, separate to implementing positive duty from the Fair Work Act, right? But actually, if you're doing it well and you look at it strategically, you can actually achieve a number of aligned things, because reconciliation will help inclusive practices, because positive duty work will enable you to address inclusive practices. So they are all mechanisms of those different things of the great whole. I love the way that, so you don't actually say to your organisations, this is the 5 you've got to work in. You let them decide and codify. Okay, great.
Yes, we let them decide. We may provide feedback on their decision.
Of course.
But we let them decide based on the data they've collected and their strategic priorities. And, every organization is different. So we let them decide, but we can provide support and we can provide feedback if they
the expertise, coaching and mentoring stuff.
So and some of the other things that they those inclusive behaviors is embedding a 40-40-20 targets into their board representation to the boards, committees, and recruitment panels. And also they have a new diversity and inclusion learning pathway for all staff at the organization.
Wow.
And there's more, but I'm just going to stop there. So all of these things that they've put in place, and after implementing those inclusive behaviors, they saw a rise from 25% to 50% in their senior leadership teams of women in their senior leadership teams, and a rise of women in those STEM roles at Geoscience Australia. Another outcome was that LGBTQIA plus staff said that they felt more free to talk about their challenges and experiences with colleagues. So they felt there was a cultural change.
Amazing.
That they felt more free and more able to talk about their experiences. And also staff showed greater trust and confidence in the complaints processes, because they saw an increase in sexual harassment reports from none in 2021 to 9 in 2022.
And I think that's really important, because so often we have these conversations and 0 reports is seen as a good thing. And it's like, that's not saying it's not happening, right? You want people to trust your system, right?
Correct.
When they go up, that means they're trusting the system. I think that's a beautiful illustration. And I think the highlight you make about the LGBTIQA plus, because, you know, heterosexuality, the non-binary, it's a barrier. It's part of the intersectional, you know, barriers that people face. And often that you can have a report that says, no, we don't have any LGBTIQ plus people. No, they're just not telling you because they don't feel safe.
Yes.
So I think that's really powerful.
Yeah. Yes. And then some other examples that I can just touch on quickly. But the AIMS Australian Institute of Marine Sciences introduced diversity moments. This falls under the low cost, I believe it was storytelling, right? They introduced diversity moments. So a 4-minute slot at all staff meetings to share thought-provoking stories about equity, diversity, and inclusion. And they said that it vastly improved communications and engagement around that at AIMS, but also increased the response rate of their staff diversity culture survey by 30%. So people felt like the organization actually cared about what they had to say. And so they started even responding to the diversity surveys. Yeah.
Amazing.
We work with Defense Science and Technology Group, and they have created a brand new, very bold promotion process and recruitment process called Navigate. Recruitment process called Navigate, and very soon we'll be able to talk about the outcomes.
No worries.
So they've been doing a lot of work, and it's going to be coming out very soon. So I'm excited about that because it's great. It's really great. We've got Geosciences Australia there, and then if we hop on to the next one, one of the ones that I wanted to talk about was ANSTO, the Australian Nuclear Science and Technology Organization. They took part, as well as CSIRO, they took part in an anonymized grant application trial, actually, which was my project in my previous role as ambassador.
Yeah.
And it doesn't say the result there, but basically the results are out. We published them just a few months ago, actually.
Fantastic.
And one of the really great things that happened at ANSTO was that it increased the success rates of early career researchers by quite a set. Where did I see it?
I believe you.
It was, okay, so it went from 60% success rate for early career researchers to 78.
No.
Just by anonymizing, so removing identifying information for the researchers involved in a research project. So basically focusing the application on the science rather than the scientist. So at ANSTO, that was an enormous result. And CSIRO, ANSTO, and the other two organizations who were involved decided to continue doing anonymous peer review afterwards.
Well, with evidence like that,
this business
science organization would listen to that evidence, wouldn't they?
Yeah.
Amazing.
So yeah, so those are just some examples.
Amazing.
We also have an intersectionality walk that we have created with some of our partners, and the intersectionality walk basically is a workshop. It's an education program that we can bring to institutions. We've given it to delivered it to over 50 organizations around the world, and it really puts you in the shoes of what it might be like for people who have intersecting identities, where our systems are creating barriers for them and overlapping and compounding barriers. So it's a really, really great workshop.
Yeah. And I think that sounds like there's often a thing called the privilege walk as well that you can do, which is fantastic as well. What I think at this point, you know, I want to, you know, thank you so much, Isabel, for sharing that. I think, you know, the evidence there is around the idea of the partnerships that we create, isn't it? You know, the internal advocacy that's going on. You're building the education. You're employing everything in that policy development. Use sexual harassment policy there. Research. So you're using the evidence.
Yes.
The monitoring. So there's constant monitoring and circular kind of learning mill going on. But ultimately, it's a partnership that you're bringing to it. I think sometimes my experience is at this point, people can go on, oh, they're big organizations. They can afford to do it.
No, not all of
universities and research, they have heaps of money and resources, don't they?
Yes, yes. But medical research institutes, some of them are quite small. And just have, you know, a couple hundred staff. So they're not all big universities. Yeah.
And there's no budget for this stuff as well. I think that's the important thing. But what I love is what you've shown here is how, as part of a broader framework, a pathway, there are organisations that set their own journey, they understand the evidence, and all of these things are things that we can all do. It costs us nothing to do anonymised recruitment.
No.
It costs us nothing to set up diversity moments. In fact, I know some of the local councils that I've worked with, they do that. They try to centre the lived experience to create and model the inclusiveness. You've always got to really support those sharing and those disclosures, but you can do that. We'll hear later about Navigate. We'll wait with bated breath.
Yes.
Proving our policy, you know, building people on that, building trust in the reporting systems. These are all things that we can do. But of course, you know, the headline here is that it's the framework, you know, it's the evidence-based framework, the long-term view. I think the long-term view is really important, but the impact is really clear to see when you do it as well.
Yeah.
So thank you so much for that. I really think that before we end, let's just think about, you know, the challenges of implementation. For mine, the grafty grindy work often comes with the exception reporting. So I just said one, oh yeah, but that's a big organisation. They can afford to do it. We don't have time. We tried that once, it didn't work. These are all actually, it's resistance and backlash. And I think one of the things we get very good at doing when we work in equity is managing resistance and backlash. Do you find that happens in your work, Isabel?
Yeah. Yeah, I think it happens. I think that's a challenge everyone has.
Yeah. Yeah. And you just take the moment to pace and lead that. And there's some really good resources out there about how you manage that. I think making sure it gets into leaders' business plans and business as usual budgets is part of it. But again, if you've got a leader that's signed on to a long-term journey, another part of the challenge, I think, too, is also to ensure that the expertise is part of that journey, right?
Yes.
If it's good enough for us to employ expertise on high voltage power lines, then it's good enough to engage expertise for the high voltage impact of intersectional inequity that flows through generations to address that. You know, let's be honest. We talked about what the indicators of success are, though. You know, you'll see changes in pay gap, you'll see improvements in utilisation and improvements in safe workplaces. And then in my day job, I can tell you firsthand, I see service change. I see more diverse services. I see greater understanding and connection with community, and I see the impact on wellness. But what I also think the story of Sage tells you is that success can be contextual. So it's not all the same. I think people often think that equity will result in homogeneity, that, you know, we come in with a big stick and say, you've got to do this, when in fact the work is actually capability building. You start where people are at and you journey forward.
Yes,
And
yes.
Isabel, I can see you've very kindly shared a few items in the chat, which is fantastic, and we'll make sure that they go out in an email. We've got the STEM Equity Monitor that Isabel referred to, but you know, we've also got the Sage application website there. So if you want further information, please feel free to contact Sage and also Wave as well.
And I'm just going to put a link to an implementation guide.
Oh, they're always good. Implementation guides, I find, whatever, are really handy, because you can have the framework, but you've got to understand how to do it. Do you know what I mean? So that would be really handy. In gender equity and intersectional work, the UN produces some amazing resources free on their website. So they've got an amazing resource on intersectional practice, which is fantastic. Implementation guide, University of New South Wales. Fantastic.
Co-written by myself and Susan Barnes from Macquarie University.
Wonderful.
Years ago, last year. So
thank you.
A lot of consultation went into that one. So we had the view of really making sure that it was useful for small and medium enterprises as well. So it's not for universities, it's not for higher education, it's not for big companies. It's really, you know, for the people who want, the smaller ones who want to make some change. Yeah, departments even within organizations as well. Yeah. Look, I think that kind of brings us to the end of this two-part webinar where we're just close to closing off time. So Isabel, I just want to thank you on behalf of Wave. It's been wonderful to do this with you. We're working together on the same journey. And I think it's just that sense of collaboration that's going to, you know, lift it. But also the information is readily available, folks. So spread the word. And if you've got any questions, you can just contact us both through our website. So thanks very much, everyone, and have a great afternoon.